Hi, I'm Jennifer Pavlinac, a nurse practitioner providing care for pediatric patients at NorthShore Health Centers, and you are watching Ask the Expert. In this month's episode, I'm going to discuss the importance of receiving recommended immunizations, how vaccines help prevent deadly diseases, and some common myths regarding vaccines. Receiving recommended immunizations are important because they prevent illness and complications, protect vulnerable populations, lower healthcare costs, reduce outbreaks, help to eliminate diseases, and can save lives. They protect both you and your community by preventing dangerous diseases from spreading. Vaccines help prevent many diseases that can be life-threatening or cause permanent disabilities. Some of the most serious include measles, which can lead to pneumonia, brain swelling, also called encephalitis, and death, especially in young children. The MMR vaccine protects you not only from measles, but also from mumps and rubella. The DTaP vaccine protects against tetanus, which is a bacterial infection that causes painful muscle spasms, can interfere with breathing, and can be fatal without treatment. Diphtheria is another bacterial infection that can block the airway and damage the heart and nerves. Pertussis, or commonly known as whooping cough, is a particularly dangerous respiratory infection for infants. They can develop pneumonia, stop breathing, or die from complications. The polio vaccine, or also known as IPV, protects children against the polio virus, which can cause permanent paralysis, and in severe cases, paralysis of the muscles used for breathing. Before the Hib vaccine became available, Haemophilus influenzae type B infection was a leading cause of meningitis in young children and could result in death or permanent brain damage. There are also different types of vaccines available for pneumococcal disease, which can cause pneumonia, bloodstream infections, and meningitis, especially in young children and older adults. The COVID-19 vaccine can protect you from severe illness, hospitalization, and death in older adults and people with certain medical conditions. Receiving the vaccine greatly reduces these risks. While many people recover from influenza, it can still be deadly. Receiving an annual flu vaccine reduces these risks. So how do vaccines work? They work by safely teaching your immune system to recognize and fight harmful germs. They expose your body to a harmless form or part of a virus or bacteria, prompting it to produce antibodies and create immune memory. If you're later exposed to the real germ, your immune system can respond quickly, helping prevent illness or make it much less severe. So what vaccine should children and teens receive, and at what age? The American Academy of Pediatrics recommends that infants receive the hepatitis B vaccine at birth, followed by their second dose at 1 to 2 months of age, and third dose at 6 to 18 months of age. At 2 months old, infants should receive their first dose of the DTaP, IPV, Hib, pneumococcal disease, and rotavirus infection vaccines, followed by their second dose at 4 months old and third dose at 6 months old. At 6 months or older, infants can start to receive a flu vaccine annually. And at age 12 to 15 months old, infants will receive their MMR, which is the measles, mumps, and rubella, varicella, a chickenpox vaccine, DTaP, and IPV, which is the polio vaccine. This information can feel overwhelming, but your pediatric provider can go over the recommended schedule with you to answer any questions or concerns you may have, as well as schedule the vaccines ahead of time so your child doesn't fall behind on their vaccine schedule. As a child, you receive a ton of vaccines, but it's still important to continue receiving vaccines even as an adult. The recommended vaccines for adults are an annual flu vaccine and staying up to date on your COVID-19 vaccine. Other vaccines include continuing to receive the DTaP vaccine every 10 years, the shingles vaccine starting at age 50, and the pneumococcal disease vaccine at age 65. Some adults may also need vaccines for hepatitis A, hepatitis B, HPV, measles, or meningococcal disease based on factors such as age, health, conditions, occupation, lifestyle, or travel. If you're unsure which vaccines you need, a healthcare provider can review your vaccination history and recommend the appropriate schedule. There are a lot of myths associated with vaccines. Some of those myths include that vaccines cause autism. This is false. Extensive research involving millions of children has found no link between vaccines and autism. This includes studies of the measles, mumps, and rubella, which is the MMR vaccine. The original study that suggested that there was a connection between autism and vaccines was found to be fraudulent and was retracted. Another myth is that natural immunity is better. Natural infection can provide immunity, but it comes with the risk of serious illness, hospitalization, long-term complications, or death. Vaccines provide protection without the dangers of getting the disease, making them the safer way to build immunity. Vaccines have improved the quality of life for people by saving millions of lives, preventing serious diseases, and reducing outbreaks. They have helped eliminate smallpox and made diseases like measles and polio much less common. If someone is concerned about getting their child or themselves vaccinated, I suggest talking with a healthcare provider to get reliable answers to any concerns. Vaccines are carefully tested and monitored for safety, and serious side effects are rare. If you or your child need a vaccine, have questions, or don't know where to start, call 1-888-313-8557 or visit NorthShoreHealth.org to schedule an appointment with a provider.